Hey everyone, welcome to the podcast Modern Couples, What Your Therapist Never Told You. My name is Rick Miller,
I'm Lillian Borges.
and we're both therapists who love working with couples. We're thrilled you've joined us today, and today's episode is When ADHD is Messing with Your Relationship. I'll begin, Lillian. I've seen a lot of couples where people haven't officially been diagnosed, but there's a lot of chaos and disorder in the lives of one of the members of the couple. Hard time keeping track of dates, losing things, organizing material, things getting misplaced, doors don't get shut, things like that. I don't know if this rings true in your experience as a couples therapist, and how do you decide if someone has ADHD or not? But just wanted to open it with this so people have an idea of what it is.
Yes, a lot of people nowadays say, "Oh, this is my ADD, this is my ADHD, can't focus today." And ADHD is something that you're born with, right? Your neurological system your nervous system is different, operates differently. And it is a problem with the executive function, in your brain. So that means that organization, planning things, paying bills, keeping track of your schedule, getting things on time, completing tests, sometimes acting impulsively, talking too much, not listening, and not being able to manage your emotions, being angry and then acting on your anger. Some of the things that can cause a problem in the relationship.
Many problems.
Yes, many problems. And what I like about the title today is when ADHD is messing with your relationship, because a lot of times couples don't realize that that's not the partner doing that on purpose.
Right.
It is the ADHD that is a problem, and the couple needs to figure out a way to manage that.
So, one of the things I was worried about with today's topic is being diagnosed with ADHD is a big ordeal. It means getting neurological testing with a neuropsychologist and getting a definitive diagnosis if you go down the route of being properly diagnosed and getting meds.
Mhm.
Then there are people that show up in my office and I think, you sound like you have ADHD. And without diagnosing them on a formal level, I'll have them do a little bit of reading about ADHD, or I'll tell people's partners to read about being a partner with someone with ADHD just to see if it relates. And frequently, what happens, people are like, oh my God, this was so helpful. But I think the most important thing that you said a few moments ago is that people are not doing this on purpose. It is a diagnosis, it's an issue, it's a problem. And one of my clients who recently was diagnosed was told that ADHD diagnoses are up 200% than from what they used to be. So, does this mean that more people are going in for testing or that it's a common issue in our society these days?
But I think this is an important issue, and I think it's both. So nowadays we are more aware. There's a lot of people who are getting diagnosed when they are an adult. ADHD in women is very different.
Oh, how so?
Women don't look like ADHD, right? Men, you see them scattered, but women, it does appear differently. Sometimes they have difficulty completing tests. They are not so physical. They are more into the mental and not able to organize things or complete tasks or projects or paying bills and things like that. So it does appear differently in women. So, and I think that nowadays, the women are realizing that, people are realizing, the professionals are realizing that, and they are getting diagnosed later in life.
What about men? What are the symptoms that are more common with men?
Well, I think I don't know if they are more common with men, but what appears more with men is the impulsivity, the not being able to complete the complete or do chores at home or complete tasks or keep deadlines and things like that.
Or let alone follow through with a conversation.
Exactly,
Um,
exactly.
I was at a meeting last week with 7 people, and I swear every single one of them had ADHD, and I'm saying it because there was no logic from point A to point B. Along the way of telling a story, people would get caught up in details and then they go off on that detail of the story and then go off on that detail of the story. And the original point of what they were talking about got buried by the details of all these different stories.
But that's interesting, right? What is the difference between ADHD being too excited and anxious? Because a lot of times when we are anxious, we also can be scattered,
Yep.
not being able to focus,
Right.
not it being able to organize. You start something and then you don't finish, and then you start something else, and then you start something else. So it is important to know that ADD or ADHD starts when you are young, doesn't start later in life.
I agree, but why is that important? If you're an adult in a relationship and it's manifesting itself in a really difficult way in your 40s or 50s, it's important because it's a biological condition or a neurological condition. But so what at the age of 50?
Well, I was going on a track of diagnosis, right? So you're talking about everybody nowadays is ADHD, and I am not agreeing with you. And I'm saying that it is not triggered by a specific situation. If you are very well organized in regular life, but when you get excited with your friends and then you're all over the place, you're not ADD. If you had ADD, you started when you were young in life, and you gonna have that problem
Mhm.
whether you are at school with your partner or in a party. You're going to be that way. That's what I was trying to say.
That being said, and I do agree with you, I think we live in a world that fosters a lack of attention.
Mhm.
And we have our devices, even on the ways in which we use social media. We don't read things, we don't concentrate. Our attention span is that of a gnat. So, like you were saying at the beginning, everyone ascribes it to ADD. And in some instances, it may be, and other instances, it may be how we're living in our world these days, which is unfortunate.
Yes, it is. And I think that, the way that we are dealing with things brings a lot of anxiety. We overschedule us. We don't focus our attention in one thing. It's 10 things at a time, and we work more. So I do agree with you. It just helps us to have a scattered brain. But again, is this ADD or it's just a scattered brain?
That's where the doctors come in. I am thinking of a couple of couples that I work with where one needed to be diagnosed with his husband because it was getting in the way of their communicating and their functioning. In another instance, a couple had one of the wife in the couple had been diagnosed, and she uses the description of her executive functioning, and she's right. And her husband doesn't believe it. And after a couple of years of seeing them, I really had to push him to go out and educate himself and do some reading because she wasn't doing everything in the world to irritate him. He was interpreting it that way. And once he read about ADHD, he was at least momentarily relieved. Didn't last forever, but it was a bit of a help. And it's a challenge.
Yes, it is. And I think that seeing the ADHD as the problem and not your partner as the problem is a big deal.
Huge.
Because then you tackle the problem, you don't keep blaming each other, which fosters unsafety and insecurity, right? If you have someone blaming you and criticizing you and not being happy with you, if you feel that your partner is not happy, is disappointed, is frustrated with you, that brings, feelings. But it brings this level of, I can't be safe here. This environment is not safe.
Well, if you think about ADHD and its counterpart, the counterpart of ADD is OCD. And in a relationship where someone has ADD, frequently what happens in a couple is that the other partner is overcompensating and feeling a lot of resentment and may be labeled OCD, obsessive compulsive disorder, or may be taking on behaviors that they don't want to take on in an effort to compensate for their partners.
Well, a lot of times ADD or ADHD comes with a difficulty in controlling their impulses, meaning they have emotion dysregulation. That might trigger an emotion dysregulation in your partner that becomes over irritable, angry, nagging, being dysregulated emotionally. So sometimes what you see or what I see in my practice is a couple that is dysregulated emotionally, and they are just blaming and fighting each other and not acting as a team.
Well, so that definitely is what I see and deal a lot with, and sometimes I feel bad for couples that are coming for couples therapy to work on their communication when there are other components, and if I can get a couple to understand this or get an individual in a couple to get tested and be properly diagnosed, then the world opens up in terms of what can be done. But I was gonna make another point, and I forgot what it was.
So, let me make another point then,
Yeah, okay.
which is a lot of times you see couples coming in, and then we have the person who has the ADHD as a designated patient. Oh, he is messy, she's messy, that doesn't pay bills. I cannot, rely on him or her, and that becomes difficult for couples therapist or the couples therapy because the person who doesn't have ADHD or doesn't know,
Right. Uh-huh.
sometimes they don't know. They like just to blame, my partner is the one that has the problem. And so when we focus on the dysregulation that happens on the two of them, then bring a different issue, it makes it easier to do couples therapy because you level the playing field. This is a problem that the two of you have. You are not regulating your emotions. You have this problem that the two of you need to tackle, and how you're going to deal with the ADD, how you're going to deal with organizing your schedule, paying the bills, picking up the kid from school, and things like that. And not so much your partner is the problem.
That's a really hard thing to do as a couples therapist because you'll end up getting couples coming into your office, as you and I both know, that want to blame their partners for everything. How often, as a couples therapist, do you encourage people to get tested and to be properly diagnosed versus not going down that specific of a diagnosis, but working on the dynamic?
What is a proper diagnosis is an interesting thing as well.
Yes.
Some couples get diagnosed by their psychiatrist,
Hmm.
and they don't necessarily go through longer neural diagnosis. A lot of times I don't question that
Right.
because the psychiatrist made the diagnosis, they are taking the medication, it's improving. What am I going to say?
Okay. So it works in that respect.
Yes, but some people, the proof is in the pudding, right? But some people, it's dicey. And it seems that something else might be also in there. So in those cases, I do encourage them to continue or to pursue a longer diagnosis.
It's funny, maybe a regional thing too in Boston. It's like so important to get neuropsych testing and be properly diagnosed with ADHD. And a lot of psychiatrists are adamant about not wanting to give medications for ADD. So, along with trying to find people who do testing, then there's the issue of how much it costs to do testing or getting insurance to do it. So it's really, really complex. However, in the male couple that I referred to a few moments ago, being diagnosed was really important for each of them.
Mhm.
For the guy that had ADD, it was important for him to actually know that there was something going on in his brain that wasn't his fault, that wasn't just his way of doing things, and that gave him some concrete reasons why he is as he is and also how to work on it. And for his partner, I don't know, it was to emphasize that there really was something going on rather than his just being irritated all the time. So in that instance, it was helpful.
Oh, of course. This is so important and validating for the two of them that there is something that the person is not doing the behaviors that stopped or the symptoms. They're not just doing it. They're just not just lazy. They're just not trying to irritate the partner. That just really there is a problem on the executive function. And so that is validating when they actually see the results of the testing, the results of taking sometimes the medication that makes them feel, focus, and do better.
I was going to ask about your beliefs about taking medication for ADHD or working on it in different ways.
Well, I think that's every case is a case. I had clients who, as an adult, said, I wish my parents had given me medication when I was a child.
Hmm.
It was so disturbing to everybody around you. I couldn't focus. I You struggle with that. I grew up with low self-esteem.
Yeah.
And I see kids nowadays are taking medication, and I was just like, "Oh, Jesus, you shouldn't." So I think each case is a case. There are mild cases of ADD or ADHD that disturb their families a lot. They don't like it, and to me, it's just like that. It's not, it's mild. I've seen worse. But that disturbed the family a lot. And some families, they are much more engaged in helping the child to, and I'm saying the child because this is when it started. When the person is an adult, there's a lot of behaviors that's already established. It is harder. But to my point that I was trying to make is sometimes the family or the mother or the parents know and learn how to manage the ADHD, and they do it very well without the medication, each case, I think.
So let me talk a little bit about that. First of all, as you were describing this, I was thinking about frequently when people get diagnosed, the questions that people are asked is to have family members and spouses weigh in on their level of functioning, so that not only is it coming from their own self-reporting, but the people that live with someone with ADHD frequently are aware of the symptoms. So frequently, their input is important.
Mhm.
What I see with treatment is the medication route usually consists of taking a stimulant, and there are some issues that come with taking stimulants. People, when they take them, when they're able to get them, they report that it's easier for them to concentrate. They're able to get things done. It's like a little magic. But then when the stimulant wears down, they feel a bit of a crashing sensation, which is challenging. In the case of working with couples, frequently the person that has ADD may take a stimulant during the day so that they can focus at work. And then guess what happens when they come home at nighttime? They're crashing a little bit, and the spouse doesn't necessarily see how they're functioning on their medications. Same with weekends, should I take the stimulant on the weekends or should I take time off on the weekends?
Yeah, so, not all medication treatment for ADHD is a stimulant. There are non-stimulant, like, Wellbutrin and other medication that are non-stimulant. So just wanted to say that. But you are right. And, if anyone is thinking, oh, I'm going to take this pill and then I'm going to be all better, medication would just do enough. And I think in the case of ADHD is such an important part that they learn how to manage it themselves. They learn how to focus. They learn how to complete tasks. They learn how to work together with their partner so they get things done.
So let me say a little bit about that. One of the modalities of treatment that is recommended for ADD is cognitive behavioral therapy. And there's a lot of work with ADHD that involves being structured, slowing oneself down. I mean, mindfulness and meditation certainly helps too. Creating lists, systems, routines, kind of identifying how you can best function in order to keep the details of day-to-day life organized and structured. And these are the things that I'm seeing impact couples in therapy because there's a general feeling of chaos and a resentment that comes with it.
Yeah, it's interesting that you're calling what you're saying the treatment and the things that you're saying as cognitive behavior therapy. I don't. I think any therapist should do those things, regardless the approach that they use to helping a patient with ADD. All the things that you listed should be done, and it's so important, and I think more important than medication, even though the specialists say that medication is the number one.
Some, some specialists, not everyone wants to prescribe.
Yes. So again, I think that helping the patients to with mindfulness, with focusing, executive function, organizing and prioritizing, all this is necessary for anyone with ADD. And we have some, actually, my person who I share, another psychologist who I share the office with, she has ADD. And if you talk to her, you will realize. But she's lovely, wonderful person, and she learned how to manage that, and that's what she says, and she actually helped me with some patients that I had in the past, realizing what is the difference between people with anxiety and people with ADHD, because sometimes they do look like a lot each other.
I'm thinking about if you think your partner has ADD, do you go to couples therapy? Do you send them to individual therapy? What do you do when you're recognizing some of the things that you and I are talking about as a listener? And it's like, oh my God, this sounds like my partner. Now what do I do?
Well, is that bringing, relationship problems, or it's bringing more of a chaos that the person needs to learn that that's more of the problem, or maybe it's both.
Both is what I'm thinking.
And then what the couple can prioritize at the moment, if they can do both, if they can do both. I think that is more of when do what first than either or, a lot of times.
I think for the sake of couples therapy, we may notice that someone might have ADHD and steer them towards getting diagnosed and taking care of themselves. But frequently, the focus of couples therapy is the interaction between the two of them, anyways, and how they're handling the tension. So that's kind of where I go first. But if I think there's something going on there, I'll pursue that with them as well. Frequently, people will be grateful, but it's a hard thing to hear if someone tells you you may have ADHD. You may want to look into that.
A lot of times they are relieved,
Yeah.
and they just want to hear that because they want to appease their partner. And the harder thing is to actually get them to do the treatment or the diagnosis. Because if they do have ADD, one thing is realizing what they need, another thing is to actually doing it. So it might take a year or or a few months until they actually do something about it. And you, as a therapist, you will be there helping them and the couple to manage that until the person can actually get something going, treatment or diagnosis wise.
So now I'm thinking back to our title when ADHD is messing with your relationship. We've done a lot of talking about diagnosis and is it or is it not, but I don't think we've talked enough about how is it messing with your relationship. So do you have any thoughts or ideas?
We did talk about how they are messing with the relationship. I've seen couples who were have a huge debt because they couldn't pay the bills, or they couldn't get organized. The house barely functioned.
Hmm.
Everything was out of place and dirty, and the kitchen, they couldn't keep up with it.
The mail doesn't get opened.
Not so much that, it's just piling up of dishes and really dirt and not being able to put the garbage out. It's stuff like that. So imagine when two people has ADD, ADHD and kids and try to keep up with life. When one person only has it and the other doesn't, so then you have the mess and one person trying to keep up and not being able to because the tornado is faster than the person who can organize. So these are some of the things. Also, people not being able to keep up with deadlines at work and work in general, or being not being able to get anywhere on time, and the partner not being able to rely on the partner who has the ADHD with anything because they're always forgetting, not keeping up with schedule. And well, how about you?
Well, what I'm thinking when you're describing this is how easy it is for the person with ADHD to be blamed for things, whether it be from a partner or from other people, because if it's not recognized, it's hard to understand that it isn't being done intentionally.
Hmm.
So you described the person with ADHD or couples who both have it, which I think it would be painful for me to enter their household and spend time there. I think I'd be going crazy. But when it comes to being a partner with someone with ADHD, it's not up to you to overfunction for your partner. And it's a constant tension of, do I rescue them? Do I do the things that my spouse is not doing? Do I call their attention to it? Do I let it be with hopes that it will be taken care of, that they're going to recognize that there's something that's been left or there's a mess? It's an ongoing source of tension. I don't think over functioning for the sake of rescuing your partner is the best way to be living, but I would guess that a lot of partners do this just to keep things moving along, perhaps for their own sanity, which is why I was kind of joking about OCD versus ADD earlier.
Well, sometimes it's not really for the sake of saving anyone. It's is just getting things done. And who is going to feed your kids? Who is going to get their lunches done and the household moving? And I think that a lot of times that's what happens. That the person who doesn't have ADD just and I think that resentment goes along with it. As a lot of fights about that because then again we talked about the emotion dysregulation that happens with the two of them when that those things happen.
So part of the task is being able to communicate with each other and hear each other about experiences and be able to convey it without being overly angry. If you're a partner with someone with ADD, it's really hard to experience it, but how are you going to communicate with your partner so they can understand what it's like for you as well as the person with ADD?
Well, you're too nice. I would say you get your shit together because I cannot live in
Really?
this fucking mess.
You would?
Oh yeah.
Oh my
Well,
god.
you talk once and twice and three times. Then what you gonna do?
God, you really shocked me. I was not expecting that.
Well, don't you think it is?
I don't know. That's great. I'm gonna play this for my couples in couples therapy and say,
I'm
"Try
not saying
this.
that, but my
Maybe this
friend
will
here
work
is saying
better."
it.
Right.
And I think I'm sorry about the F bombs, but I think that yes, there is a moment where you want to talk to your partner and say, "This is what's happening." A lot of times, partners who have ADD, they get into a complacency or a complacent place behaviorally, but also in their attitude. Oh, this is my ADD. You know that I have a difficulty with this.
My free pass. I got it.
Yes,
Yeah.
you know it. And I don't do things, and my partner is doing it. So there is a point that the partner needs to say, enough is enough. We need to be dealing with this as a team. We are not, because you're not doing your part. I'm doing more than my part, and you're not doing yours. You need to do something about this. You need to take charge of your ADD and take charge of your life because it has been hard to live with you.
Okay, so you are all for being assertive, and I think that's great because there's a dynamic of over-functioning and under-functioning that becomes part of the system that is challenging and difficult for everyone. Okay, how about a therapist? You're a couples therapist. When you're seeing this dynamic in a couple, are you as assertive as you are right now?
What I would do is I will be assert because if the partner who doesn't have ADD accepts and don't get strong with the ADD partner, I, as a couples therapist, have no leverage. I have no leverage because the only person who has the leverage is their partner. If the partner is accepting by, oh, I talked to him, oh, I talked to her, oh, I know that that's difficult for them, so I do more and I understand. So then what's the problem?
Right. How did you end up in couples therapy?
Exactly, right? So I don't have the leverage. So then I go after the person who does accept. So then I started working with him or her in that sense. And then of course I tell them both, but and sometimes I do very rarely, but very rarely say you're accepting you're doing it. But there's no need to change in the system here. The system is working very well.
Right. I can't picture doing that.
What do you think about what I said?
I like this stance of being a couples therapist and working on or working with the partner who's codependent, over functioning, doing things, excusing their partners. I mean, I see this a lot with substance use and misuse as well. And I also like the idea of if you need to take the upper hand and call a spade in the context of couples therapy, maybe this is the place where they're going to hear something instead of both people putting blinders on or avoiding what needs to be vocalized. So um, I I haven't needed to confront people in an overly assertive way because I have people go between sessions and at least look online or do a little bit of reading and see if they relate to it. And it's like the switch went on. It's like, oh, I didn't have to do a lot because the evidence is out there in the world. And if they do a little research, they see themselves in what they're reading and they agree with it and feel some kind of comfort as a result. So it's work.
So, and that's good, right? That's all good. If you send them in the right direction and they feel relieved and they say, "Oh, that's what I have. This is what I need to do," and they start doing it, that's great. There's nothing I need to do. What I did actually helped them, and then what I need to do is actually giving them some strategies, support, and helping them talk about that, which is great therapy. The problem is when that doesn't help, so then you need to put some more pressure. I love that you said codependency because that's what happens. The partner who doesn't have ADHD is start acting codependent. That just develops a unhealthy dynamic between the two of them.
So obviously, we're couples therapists, so we're approaching it from the vantage point of couples therapy. We're talking a lot about treating couples, but there's going to be a lot of people listening to this podcast that won't even consider going into therapy. So I guess this would be one of my takeaway points, which is to educate yourself. If you're listening to Lillian and I today and you're resonating with some of the things we're talking about, read about ADHD, look it up online, go to a bookstore. There's a lot of information out there. The issue is it's easy to overdiagnose yourself because we all do that, but be attentive to the behaviors and see if it resonates with you or your spouse in your household.
Yeah, and as you see yourself in some of the, in maybe sometimes all of them, and so address that and use the skills and the things that you see online to address that, so it helps you as a couple, it helps you to have a better communication, it helps you to have a better manage of your emotions, so it improves your love life, your family life.
Yeah. And even without a diagnosis, being attentive to time management, to structure, to mindfulness, keeping track of time, these are all good things in the busyness of life to be working on, anyways.
Yeah, and I think that I trust a lot in teamwork, picking up the slack in your when your partner cannot really focus, you could tell your partner, you're a little scattered today. What's happening? No, or I am feeling a little scattered today. This is what's happening. Can you help me? So I do trust and I do like a lot about the teamwork and the co-regulation, and that works a lot for a lot of people.
Oh, that's a good one. Yeah, great. Other takeaways?
No, I think that that's it. Learn about what it is. If you are a little lost learning online, go look for a specialist that can diagnose you, that can help you with that. I think that would be the best. And there's a lot of coaches and therapists
Yeah,
that are doing incredible job with ADD, groups that do a lot of incredible work with ADD. You don't need to be suffering with it by yourself and alone.
absolutely. And as more people are getting diagnosed, there's more services, which is a really, really good thing. So that is it for today. Thank you, as always, for joining us for Modern Couples What Your Therapist Never Told You. And we will see you next time.
See you next time.
Thanks,
Bye.
Lillian. Bye
Thank
bye.
you, honey.